So I'm Patrick. I'm a 21-year-old mild haemophiliac type A. I've just finished my paramedic degree at Flinders University and hopefully next year go into full-time work as a paramedic for SA Ambulance. I was diagnosed with mild haemophilia type A when I was born, and that runs through genes passed down through my mother. So a mild haemophiliac, it tends to not really affect your quality of life that much if you manage it well. And that's where I came in trouble because I didn't really manage it well. When I was playing football when I was a lot younger, I didn't like to acknowledge that I had any injury. That way Mum wouldn't make me go to hospital to get it treated. Since I've got older, I've certainly been able to firstly acknowledge that I do have the injury, but then also treat it a bit quicker than making the injury a lot less severe. That goes back to me accepting that I've got haemophilia and wanting to manage it the best way I possibly can. At home, I administer my medication intravenously most of the time, and that medication lives in the fridge. And so there's always a couple of doses in the fridge. I'm quite fortunate in where I'm born now to have access to the treatment which I do have. My uncle, who's about 60, he ended up having to get full blood transfusions, which was the previous treatment for haemophilia. My uncle ended up with hepatitis C out of his treatment because his treatment was live blood products through blood transfusions, whereas my treatment is completely synthesised clean, a perfect factor VIII, as opposed to a live blood product. Within the last 30 years, there's been quite an amazing advancement in technology to make treatment safer and more accessible for other haemophiliacs who are having to treat more often. Having access to, I guess, easier and safer treatment throughout my whole life will certainly benefit my longevity because I won't have these injuries which would then progress to more severe problems later in life. Being an advocate for patients with haemophilia and being able to put myself in a position to both raise money as well as just to show what can still be done as a haemophiliac enabled me to give back to a community which when I was a lot younger, didn't necessarily appreciate. In terms of advice for younger haemophiliacs, it is just a matter of appreciating what is on offer for treatment and what's on offer in terms of support from the haemophiliac treatment centres in your states, as well as the various other physiotherapists and doctors and nurses that you are in contact with. Because unlike many other conditions, we have direct access to our doctors to then get advice within the hour. If I had to describe myself in 3 words, it'd be glass half full. There's always some sort of optimism about life.